Facebook. Happy Friday. It's Nicea DeGering. Hopefully you're doing something fun this weekend, but we have some chat that we have to get to before the weekend, and this is some real talk, everybody out there. I'm at Lighten Laser Cosmetics, and I'm sitting with Rena, and I'm also sitting with Shannon on the end. She and I both had a procedure done that we're going to tell you about in just a minute. But first, Rena, we're in Bountiful. I want you to explain to everybody out there on Facebook what you do here at Enlighten.
So we do a lot of things here, actually. One thing in particular we're going to be talking about today is the Geneveve treatment. However, here we do cool sculpting, we do Botox, we do fillers, we do, goodness sakes, we do old therapy. Dr. Mears does CO2 treatments. We do a myriad of things in this office. But today it's about Geneveve.
Well, and we're talking about the Geneveve. I know you don't know what that is, everybody out there, quite yet, but this is the treatment room. Like, they let us in the room that they do the treatment. This is where I was for the last just 30 to 45 minutes getting the treatment done. And it's a beautiful location.
Isn't it, though? We're here up in East Bountiful. It's beautiful. Our suites are really, really nice. I mean, they're open. They're wonderful. We've got some great features to them, too, as well, to maybe even take your mind off a little bit about what's happening during your non-surgical vaginal rejuvenation. We've got TV. You can pick your own channels. It's nice in here. It's very, very comfortable. Not to mention that the procedure itself, very comfortable.
Okay, you said it. You said what this procedure is. This is a non-surgical vaginal rejuvenation. I told you we'd get real. We're going to. It's Friday. We're doing it. This is girl talk, though, and this is talk girls that you should be having, right?
Absolutely. This needs to be an open dialogue that women feel like they can have with other women, but also with their provider, and then also with us. Come and see us. We'd love to have an open dialogue with you about this non-surgical vaginal rejuvenation.
How new is this procedure?
How new is this procedure? Well, here we've been doing this procedure about 8-9 months. However, this treatment has been around for a lot longer than that in other countries.
What does vaginal rejuvenation mean? Why would someone do this procedure?
Well, vaginal rejuvenation in and of itself is a pretty broad term, isn't it? People think of things that maybe sound a little bit scary, I feel like. They think of maybe labiaplasty, maybe surgery to me. I mean, that sounds a little bit scary.
What? People are like, why on earth would I let anything near that area? Like, I'm afraid to talk about it, let alone put a laser there.
Agreed. I mean, it feels a little bit scary to talk about that. When you're talking about your vagina, it tends to feel like, okay, non-surgical, what is this, right? So we want to answer that question today. We want to open up the dialogue, talk about this so that women feel comfortable, so that they can know even what it is, what we treat. You're right. We need to know. So.
Shannon's waiting because she has had this done. So have I, but she had it done last May. So we want to find out how you are feeling now and why you had it done. But first, I want to throw this out there, everybody. We are chatting. Like, I would love you to chat with us here on Facebook Live. So if you have any questions for Rena about the Geneveve or any other treatment that you've been thinking about, she would be happy to answer those. So throw those at us. We'll answer those over the next several minutes. Okay, let's get back to it, though.
Yes.
So why would a patient have this done?
So a patient would have this done if they're experiencing stress urinary incontinence.
What is that?
So that is laughing when you sneeze, when you run even, when you're coughing. Lots of different instances. We get a lot of people who are big into fitness, who work out. They're peeing their pants when they're doing a squat, or they're peeing their pants in just regular workouts. Wearing a pad during workout, wearing a tampon during yoga. Not okay. We can help that. We can fix that, right?
No, and incontinence is a pretty word for peeing your pants every time you do a jumping jack, right?
I know,
it happens.
Right? Jumping on the trampoline. Let's think about those everyday activities that we're just accepting as being okay, but we can't on a daily basis do those regular activities and interact with people, not to mention our little ones, right?
Does this happen to most people who have had a vaginal birth?
Yeah, so it's very, very common with people who have had vaginal births. So you start to lose that tone and the muscles start to just atrophy. So we get people who have had multiple children, but even just one, you can start to have that stress urinary incontinence that affects daily life.
Well, not only that, just that skin aging there, right? Just that happens. I mean, you're aging other places. It makes sense that it's aging there as well. The laser gets right up in that area?
Well, the radio frequency energy is pulsed into the tissue. So, I wish we had the treatment tip right here so I could show you. It's about this size. So the treatment tip is about this size, and you just had the treatment. You've had the treatment.
It's not scary
at
all. It is not
scary. I have had the treatment myself. We should mention that as well. So I know what it feels like personally. We all do. But the treatment tip is inserted into the vaginal initial opening, which is called the introitus, and we're treating it with that energy pulsed into the tissue. And what the technology does is it forces that collagen and elastin to remodel, to rebuild. So then we're getting that strength and that tone in the tissue. And it looks like we actually do have the treatment tip, which is very nice that they went and grabbed that.
Not, I mean, this is not
This is so small,
invasive.
ladies.
It's really not.
Non-invasive. It pulses energy, so there's heat, but then it has a patented cryogenic cooling that happens with it, and I'm sure you felt that. You felt that a little bit, right? So it's cooling that tissue as it's heating up, which allows us to not have any downtime. We're not cutting the tissue. Ablating the tissue is what it's called. When you talk about other treatments, they're cutting the tissue. This does not. Very simple.
I asked you that. We sat down before and talked about the procedure, and I said, is this like the CO2 laser that I'm sure so many of our viewers out there have heard of? This is different?
This is very different from CO2. Yes, CO2, you have to go in for multiple treatments. They are ablating the tissue, which is cutting it. That initial opening to the vaginal canal, they're going to be cutting that tissue to get an inflammatory response that forces the body to recognize that, hey, we're going to remodel, we're going to rebuild that collagen in that area. But the science behind this technology, we don't have to do that. So there's no downtime. It makes it wonderful. 30 minutes and it's very comfortable, isn't it, Shannen?
Yeah, it's very
I know, Shannen, I need to get to you. Tell me why this procedure? How did you hear about it? What made you think I might want to try that?
Well, I'm a patient here at Enlighten, and I heard about it when they started advertising it, and I was interested because I've been married for 15 years. I have a child. I thought, well, if we can make the bedroom life a little more fun, let's try that.
Well, and that, in fact, Rena, isn't something we've talked about yet. We were talking about the incontinence part of this, but what about the sexual function part?
Right, we haven't even gotten to that part, and that is such a huge part of our daily lives. Men and women, sexual intercourse, we are talking about the benefits this treatment does for that. So when we're treating the tissue, the vaginal tissue, with radiofrequency energy to remodel and rebuild collagen, all of a sudden you're getting a better sexual response because you're getting better friction between two partners, which creates better orgasm. Yes, we're talking about that as well today. Sometimes people maybe have a little bit of a hard time talking about their sex life. 14, 15, I don't know how long you've been
22.
married. Exactly. As time goes on, our vaginal tissue is aging just the same as our facial tissue is aging. So we do need to address the fact that we as women have vaginal tissue that's aging, and doing this treatment can definitely help with sexual function.
Because of the tightening.
Yes.
That's what's happening.
Yes, that's what's happening. And it's not just that. We're building that and remodeling that collagen in a way that it's building that support within the vaginal tissue so that you're getting almost, yes, tightening, absolutely, but you're getting better friction between two partners, better orgasm, and I mean, let's be honest, that's what matters, right? I mean, that's part of it, is that satisfaction
in your relationship.
Yes.
Okay, if you just tuned into Facebook Live and you're like, wait a second, Nisha, what are we talking about today? We're getting real. I am at Enlighten Laser Cosmetics. We're in Bountiful, and I was just getting back over to Shannen, who had this done last May. So you decide, you've heard about it, you've been married 15 years, you're like, let's see. Talk about the procedure itself. What was it like?
The procedure was very, very comfortable. Dr. Mears actually used to be my OB, so I have a relationship with her, and she's very easy. She's a very warm, easy person. Yeah. So, and I'm familiar with everyone here, so that part was great. But it's lay down and it's warm. I was nervous, is this going to hurt, or is it going to be intense? Is it going to burn? I have episiotomy scars. So that's where I understood that the intensity might kind of pop up. It might feel hot or uncomfortable. Honestly, it was calming. It was just great. I was like, oh, you're done? It was so quick and painless. And
30 minutes.
Yeah, and I watched TV. Not kidding. I started a new show on Netflix.
Do you know what made me
Life in
feel good?
Pieces.
I loved that an OBGYN was doing the procedure.
It makes
That's
such a
what I
difference.
loved. This is someone that knows what they're doing. Is this procedure safe?
Absolutely, and it's FDA cleared. So yes, absolutely, it's safe. The technology behind this has been around for a very long time. And when I say a very long time, we're talking in excess of 15 years. So.
All right, so Shannon, and I can echo what she said. It was really no thing. I mean,
No,
this is
not
not
at all.
an invasive, scary thing at all. It takes minutes. We chatted through the entire time.
Oh, we had a good time.
So now here we are. I mean, I'm 30 minutes out. You're many more days and months after that. What did you notice?
Initially, we were sort of excited to take the new gear for a trial run.
Test drive.
And what I understood was that it would take about 30 days till we would notice anything. My experience was a little different. It was like the first time. We were both like, oh, so that's fun. The sensitivity is amazing. I truly felt like setting the clock back, like a start over. There were a lot of pleasant surprises that came along outside of the bedroom that I didn't realize were issues that I was having. And I liken it to dents on the wall. Like, you walk by them enough times, you stop noticing them. I think that's true with our bodies and how things work. For example, getting out of the bathtub. You know, get up, get out. Sometimes there's a little bit of water slipping. 5 minutes later, you bend over to get dressed, and you're like, oh, oops. That doesn't exist for me anymore.
That's what happens. I know, yes.
And the water swimming changed, jumping into a pool and then getting out. The floodgates are no longer open.
But you're right. I mean, these are things that as women we just deal with, and we actually maybe don't even talk about with our best friends because we're like, I guess this is it. And it doesn't have to be that way.
No, I felt like I was shocked with all of the little things that I didn't notice. As a matter of fact, on the form you fill out, what are the issues? I think I said I didn't have an incontinence problem because I truly thought that was true. I thought that was a true thing until I actually didn't. And then it was like, oh, so now we're getting very real right now.
Oh, absolutely.
So now when I finish in the restroom, I don't wait for the second.
You don't sit.
Yeah, I don't wait for the second coming. Just done.
That's
done
it.
is done. Like it's really.
And you noticed that within the first 30 days. Did you really?
That definitely, but it was about 30 days when I started noticing those changes, and by 90 days I was just thrilled. I'm still thrilled, and it's been 7 months. Yeah, 7 months.
So you'll see improvement 30 days. Will you keep seeing improvement for months after?
So typically a patient would start to notice results at about 30 days out. That being said, everybody is different. So to manage expectations in between 30 and 90 days, but we can even say that collagen is going to continue to remodel at up to 6 months, right? So your experience could continue to get more and more better or improve over 6 months. So, and I wanted to kind of touch on what she was saying about the sensitivity, the sexual sensitivity. When you're increasing blood flow in that area by collagen remodeling and rebuilding, all of a sudden, things start to get a lot more sensitive. When it comes to your sexual response, that really makes a difference when it comes to sexual arousal. The ability to become aroused and then to stay aroused during intercourse is absolutely improved by this.
These are questions that I don't know how many people talk about with their OBGYN. Do you out there? I don't, because I don't know if I ever have. So you come in here and you sit down with Rena, and how many women have sat down and said, this is impacting the happiness of my relationship?
If I had to put a percentage on it, I would absolutely say that it's 100% because I can pinpoint each person having their own individual issues that are affecting their daily life, but the overall consensus from the women that I get coming in through the door to see me is that they just feel like there hasn't been a solution. Number one, is this the solution? And number two, I just don't feel like anyone's ever heard me talk about this, and I feel so relieved that I can finally express to someone that this is going on, this really is happening. It's almost this anxiety that's built up over time that we as women have just accepted it as normal, And then they get into the treatment room and just the floodgates open of this relief, feeling like, okay, I'm finally going to be able to talk about this, and there is a solution. To me, that's the most rewarding job in the world, is to be able to talk about these things with women and to help them.
I'm with Shannen. I was like, I guess I'm okay. Like this happens or that happens, and you do, it becomes normal. I guess this is fine. And Rena goes, I guess it's not. We're going to improve that and change that. We're at Enlighten Laser Cosmetics, everybody. We're in Bountiful. We're doing some real talk about the Geneveve laser. You might have heard something about it and thought, what is that exactly, and does it work? If you have questions, send them in, because Rena is answering those right now. If you have questions about it, you've been afraid to ask. Shannen, you would do it again?
Yes, I would. And I sort of want to. We haven't discussed that, but it can be done more than once.
To retreat.
And sort of, you give a mouse a cookie. I'm like, well, if it was this good after one time, maybe I want to do it again. I can't tell you how satisfied, and it's not just a one-time. I haven't gotten used to it yet. It's still thrilling, and I don't buy as many panty liners. There are just so many things. Like, I don't worry about wearing light-colored pants or having to make sure my leggings are covered, you know, no shirts past the butt, so that if I'm jumping around or doing something active, there's no surprises.
I love that this is for you. I mean, great, it's made your relationship probably with your husband better, but you did this for you, to feel good for you.
Yeah. It's been really empowering, I would say. Like,
I like that word too. Me
Oh
too.
my goodness. I know. I talk about that all the time. We are empowering women to better themselves because they want to. You know, it's a wonderful feeling, I think. It gives you that sense of empowerment. It just does. It's a great word.
Well, and it's one of those things, again, we talked about at the beginning, you don't have to not say, I'm not good. I'm not good there.
Yeah.
And we're so afraid to say that out loud as women. We would know it's fine. Just don't talk about it. Do talk about it, because there's something you can do about it now.
Exactly. I know. It really is something that women do need to open up, talk about. I know you might be nervous to do it right at first. It might be an issue of trust even, that, gosh, I don't know if I want to share this because it feels maybe uncomfortable. But if we start talking about things more, all of a sudden you get more women speaking up and saying, oh my goodness, we can do something about this? Okay, yeah, let's talk about this and see what we can do about it. So,
all right, we asked you earlier for questions. Please send those in if you have any for Rena. We'd love to answer those at Enlighten Laser Cosmetics. We haven't talked about price or insurance or any of those nitty-gritty things. We need to.
Not quite yet. We haven't. Yeah. So this treatment is a medical treatment. It's performed by an OBGYN, Dr. Molly Mears. We do accept, or it can be used, HSA accounts can be used for this treatment. Also flexible spending, which does expire at the end of the year. Each calendar year does. So if you do have flexible spending, make sure that you come in, have a consultation, and, you know, use those flex spending dollars for something like this. We talked about doing something for yourself. Do something for yourself with that money that you've set aside. So that can be used. And then also for financing options, we do accept Care Credit. That's a simple application that's done online at www.carecredit.com. And we do take that financing as well.
I love that. Well, I mean, that's huge that the health spending account can play into this, because I love talking to Dr. Mears, and I felt so comfortable that it was a doctor actually doing the procedure. What's the optimal age that someone should think about this? I mean, Shannen and I are in our early 20s.
Right?
yeah.
But for those of you that aren't, when should you think about it?
I mean, honestly, I think that's on an individual basis. And the reason why is because I think that you can do this, and I know that you can for sure, even if you haven't had children. We live in Utah. Typically, people are having children just a little bit younger. So maybe you would get clients who, and I do have clients who are younger, in their 20s, who are coming to me. They've had multiple children already. They want to see if this can help them. But then we also do have a more mature demographic of people that are in their late 60s that have come in to have treatments as well. So we do have a very broad range of women that can come in. And I don't feel like there really is a right age to start thinking about about it. I think when we start thinking about aging, everybody applies, right? All women are in that group where, yeah, we're thinking about it. So,
well, and babies did a number on you. If you've had a baby, you know it can do a number on your body. Okay, Shannen, what would you say to people watching out there if they're considering it, or if they're even going, I can't believe you three did this? What would you say?
I would say it's December 1st. If you do it now, your New Year's Eve is going to be exciting.
I love Shannen.
Yes, you're so great at expressing that. Yes, that urgency, because honestly, when you start thinking about doing something for yourself, the time is now. It's not, well, let me see when. You've waited until then. Now is the time. Now is when.
Are you mad you put it off now? Are you mad you were like, I mean, you probably like found out about it and did it, but I mean, maybe that you didn't know it was out there before.
Yeah, well, yeah. I wasn't really anticipating there was going to be this
epiphany.
Yeah, all of these
new
things
experiences.
that I'm like, what? Shut. Yay.
Yes.
But now that I know, I sort of feel like there's some saying about if you had the wisdom you have when you're older, but the body you had when you were younger.
Yes.
I kind of feel like this gave that to me.
That is wonderful.
Like
The bonus of both.
yeah, you're kind of it's a refresh, and it's back to pre-mother for me. Back to pre-mother feelings and
I like that word about it too, the refresh. It is.
Oh, absolutely, and that's what it is. When your collagen is rebuilding in your vaginal tissue, just like on the face, if we're doing something on the face that's going to remodel and rebuild collagen on the face, all of a sudden, don't you look a lot more young? All of a sudden, you just look like refreshed. Exactly, yes.
Well, and Rena, what's interesting is we don't flinch talking about it on the face.
No.
Right? Your friend has it done. You go, oh, really? Like, how'd it go? Tell me about it. We talk about this and people go, what on earth? What? But then you learn the benefits. Then you learn how it works. And you say, why not?
And then they want it too. That's the thing. If we can open up the dialogue, let them know that it's okay to talk about, and yes, we should be talking about this because we want to help ourselves as women and empower other women. Talk about it with your best friend. Talk about it with that woman at the grocery store. I don't know, but just talk about it. That's all I think that's really important, is us as women talking about these types of issues.
I want to wrap up with the health benefits because we've been touching on those throughout, but really list them off for me, Rena, because, I mean, along with sexual satisfaction, there are some serious health benefits that this can help you with too.
Right, so when we talk about stress urinary incontinence, that's definitely one. Sexual function is going to play a big part, and the kind of like subcategories of that are sexual arousal, orgasm is going to be improved, vaginal laxity is going to be improved as well, so you're not going to have that overall feeling of looseness anymore. It's going to feel just a bit different that way. So, and we say it always kind of in just a little bit of a tiptoe because, you know, you never want to say anything that's going to offend someone, but for sure we do want to talk about it. Other health benefits, I mean, come in, we want to make sure and customize it to your specific concerns. I think that's the bigger thing, is that this treatment targets so many things that I almost feel like in some ways I can't list all of them off. So,
well, and it's individual, like you said. I mean, what you need and what you're looking for your body and what will work for you, that's what they're going to talk to you about. And make a plan for you. Enlighten Laser Cosmetics, everybody. We are in Bountiful. And call them. Like, can you schedule a consultation and come in and chat about it?
Absolutely. Yeah, you can call in, schedule a consultation. I'm the one that personally does all of the consultations, so you'll be meeting
so fun.
with me. Oh, thank you. You're so nice. So it really is, you're going to come straight in. We're going to have a consultation for about an hour. We'll have you fill out some forms, some questionnaires specific to your concerns, so we get a really good idea of what's been going on with you. And that way we can target what we'd like to treat with you specifically.
Well, and again, this is the treatment room. I mean, it's nothing to be worried about, concerned about. We're sitting in the treatment room. I was here minutes ago. I mean, this is the laser right here. I mean, you're laying here. It literally takes minutes. Shannen just told me she watched TV there. I was too busy talking. You'll think that's odd. But no, it's that. And then you're done.
Yeah.
And Shannen happier than ever.
Yes, truly. Also, I want to point out the downtime. It's been stated that there is none. That is 100% true. I have had more impact in my life washing my car. There is zero. There is nothing you get home, you don't feel weird, you don't feel, there's no cramping.
No pain.
There's
No
no,
cramping.
I
I know,
didn't
I thought
have
that too.
spotting, I didn't have cramping, there was nothing. I was,
So no pain during the procedure, no
None.
pain after the procedure.
right.
And then within a couple days,
Sunshine and rainbows.
Sunshine.
Yes.
I'm taking Shannen with me.
I know.
Right?
You're so great at expressing yourself. I love it. It's, yeah.
But I thought it was important to have someone not only who just tried this, but someone who has been through it for months and months and seen the actual results. If you would like results yourself, everybody, go to Enlighten Laser Cosmetics. I know they have a website. Share this. Talk with your friends about it. I love that we got to do this before we launched into the weekend, girls. Thank you so much, Shannen. Thank you, Rena. I appreciate it.
Thanks for